Hello everyone. I am Dr. Sridharan, Assistant Professor from the SNS College of Physiotherapy. In this video, we're going to see about the condition which is called as low back pain. What is low back pain? It is a common painful condition that affects the lower part of the spine, which involves the muscles, nerves, bones of the back. According to the one of the study, almost 80% of the persons in this modern world were experiencing the back pain due to their sedentary lifestyle and due to their conditions working. According to that, the 80% of the world population is experiencing the low back pain. Fortunately, in 70% of these, it subsides within the month, but as many as above 70% of these which whom pain has subsided, the pain reoccurs occurring remaining 30% of the persons. So now we're going to see about the causes for the back pain. So generally the back pain is caused by two different causes. So first one is specific cause and second one is non-specific cause. Specific, where these can be detected, and non-specific, where no specific cause can be detected. In some cases, postural and non-specific work-related trauma is most common in the most of the low back pain cases. So now we're going to see about the specific cases. So in specific cases, first one is congenital cases causes. So what are the congenital causes for the low back pain? So the first one is spina bifida, lumbar scoliosis, spondylolysis, spondylolisthesis, and transitional vertebra. And the traumatic causes for these are sprain, strain, vertebral fractures, prolapsed discs in the prolapsed intervertebral discs. Next, the inflammatory causes are first one is tuberculosis, ankylosing spondylitis, and spondyloarthropathy. And degenerative causes such as osteoarthritis and neoplastic causes such as in benign it is called as osteoid osteoma or eosinophil granuloma. In malignant stages it is called as the multiple myelopathy or lymphoma. Metabolic causes such as osteoporosis, osteomalacia, in some of the non-specific causes such as functional back pain, postural back pain. In postural back pain, it is due to protuberant abdomen, occupational bad posture, habitual bad posture, and sedentary lifestyle. So first we're going to collect about the history of the patients. So first we have to collect the age of the patient. So back pain is uncommon in children, but if it is present, it is often due to some of the organic diseases. In adolescents, due to some of the cases such as postural or else traumatic causes may dominate the causative factor for the low back pain in adolescent period. In adult ages, spondyloarthropathy and disc prolapse are most common. In elderly patients, the degenerative arthritis, osteoporosis, and metastatic bone diseases are the usually causes for these conditions. Second, we're going to know about the sex. The back pain is most common in the women, particularly they have had a pregnancy. So this is due to excessive weight and the lack of exercises, which leads to the poor muscle tone and nutritional deficiency. Whereas in the case of male, the pain is more often that is not due to its obesity, but it is due to a bad posture. Next, we have to find out the occupation of the patient. So people in the sedentary jobs are vulnerable due to the abnormal activities in their job. So it most commonly seen in surgeons, dentists, computer professionals. And then we have to find out the past medical history. The past medical history has been suffered from the spinal diseases such as traumatic causes and the inflammatory diseases, which may point out that it is a leading causative factor for the low back pain. Then the localization of the pain, so whether the pain is localized at the particular area or it is also and referred to the throughout the lower limb, which is also known as the sciatica. In the neurological signs, it also shows the neurological signs such as numbness and tingling sensation throughout the dermatome region. And the associative symptoms for these are stiffness, pain in the other joints. So stiffness in the most painful in back regions, and the pain in the other joints such as the traumatic diseases, which is also an associative symptoms for these low back pain conditions. And it also shows the neurological symptoms such as paresthesis, numbness, weakness at the point of lesion at the nerve tissue, and it also shows the limited range of motion. And the extraskeletal symptoms, which are a history of abdominal complaints, urogenital complaints, or also shows the gynecological complaints, may indicate an extraskeletal causes for the back pain. When it also mental status also is one of the symptoms. It shows that rule out and psychological causes for the back pain, which are the hysteria, malignancy, etc. The patient suffering from the organic diseases may have often significant overall in the psychological factors. So these are the history collections for the history collections, and also causes and also symptoms for the low back pain. So the other segments of the low back pain we are going to see on the next video. Thank you.